Hi there. Welcome to today's session, highlighting the realm of speech-language pathology and the supervision that is connected to creating a functional, ethical, and thriving working environment. I'm John Rose, and I'm an educational consultant with PATN, the Pennsylvania Training and Technical Assistance Network. Um, and I'm very excited to start this training with our leaders in Pennsylvania who manage and lead speech language pathologists in the schools and at our intermediate units. So, a little bit about myself. Number one, I'm a speech language pathologist, as I said before. I've worked in the schools, clinics, in the homes, preschool to age 22 in the high schools for around a decade. I'm also, as I said before, an educational consultant with the Pennsylvania Training and Technical Assistance Network in Harrisburg, so Patton Central. I'm an adjunct professor at Salus University, right outside of Philadelphia, and I'm also a holder of the Certificate of Clinical Competence from the American Speech and Hearing Association, which we'll talk a little bit about later, as well as holding a state license in Pennsylvania for speech language pathology. And then finally, I also have an instructional 2 license for teacher of the speech and language impaired in the schools. So that's just a little bit about me. I don't have any other financial disclosures to make, other than what I'm receiving from Patton as being a consultant with them. So, what are our learning objectives for this training? What do I want you to walk away from this training with? So, first of all, I want to talk about the evolution of speech pathology in the schools because it's a it is a very rich history, but it's also very short-lived in the grander scheme of things, especially in education and special education. But you'll see some similarities with how we kind of helped as speech pathologists in special education and how that came to be. Second, I want to talk about the three-pronged approach to eligibility for speech language services in the schools, especially in Pennsylvania, as our LEAs tend to have their interpretations of what those laws are, and that we follow IDEA. There is no set definition for eligibility and dismissal in Pennsylvania per se, but we do follow what IDEA talks about, which we'll get into. We'll talk a little bit about listing of service delivery options for school-based speech language pathologists, especially some ones that aren't necessarily seen a lot in the schools, but are really viable choices for speech pathologists and for the students that we serve. We'll discuss the benefits of using workload models compared to a caseload model. I'm sure you've heard of that. If you have worked in the schools and worked with speech pathologists, if you haven't heard of that, I'm happy to share that with you today because that is something that I really, really, really want our leaders to take away from. If not anything else, this is definitely one of the bigger ones that I would like you to really soak in. And then finally, I want to identify best practices when observing speech language instruction corresponding to the Danielson framework. And we'll get into that a little bit as we go towards the end. So with that being said, I would like to go over just a quick synopsis of speech language pathology, especially in the schools, and really dive deep into what our profession looked like over the years, because I feel like learning the history of speech pathology is really going to help make future decisions, not only actually in the world of speech pathology, but also in education as well, and how treating students and working with students with communication needs in the schools has changed over time, and how important it is that we remain open to change, that we remain open to has happened in the past that has formed us what we do today. So it's very, very exciting to kind of look into that. So go over that a little bit. So this is just some information regarding certificate versus licensure. So there are three categories I kind of wanted to talk about today. So the first one would be a PDE issued certificate. So the certificate, as you can see, is the only requirement per the Pennsylvania Department of Education. This is pretty much everything that you need to teach in the schools. Certification for clinical competence, or CCCs, that is not required per PDE. Same thing with PA state license, required to work in the schools per PDE. No, that is not required. So really the only thing that you do need is that certification from pa.gov. If you go onto the patent website, which will be shared at the end of this slide, or excuse me, at the end of this presentation, that will have that information in there for you. This will give you a little bit of a nice background to what you really need, what the issuing body is, credentialing, and then at the bottom also billing required by access billing. So, this is just a picture of the table that you'll find on the patent website, but the link is in there. So if you do want to check that out to look at more, that is available to you and your speech pathologist. Again, you don't need to work in the schools. You do not need the certificate of clinical competence in Pennsylvania, nor do you need the PA state license in Pennsylvania. It is truly just the PDE issued certificate. There are different components and different things that you're able to do, such as medical access billing, what your certification name would be, like your C's, your licensure, teacher certification, and so forth. But this will give you a nice breakdown of everything for you. And like I said, if you need more information, that is on the patent website. In comparison to what we were talking about before, so in relation, of what we were talking about before. So the SLP certificate, so this is what we need to work, need to have to work in the schools. There are two categories that your speech pathologist may have. One is called the Instructional Speech and Language Impaired PK to 12 certificate. The other one is School Speech and Language Pathologist Pre-K to 12 Specialist. Both of these certifications require similar training. They require similar certification to treat in the schools. The biggest difference is that a speech language impaired certificate holder can be a teacher of record on an evaluation, and can also be a teacher of record in a speech and language classroom. So if there is like a self-contained classroom of some sort, they can have that. The educational specialist cannot. So that's the biggest difference. The other difference, again, is the testing. So we also both have to take the Praxis 2, but the Praxis 1 core test is needed to be the speech and language and to have the speech and language impaired certificate. And both of them require continuing education, the 180 hours every 5 years. So keeping that in mind. The other component that is a little different between the two is the instructional certificate holder may add additional subjects via testing. The educational specialist may not. So there are just some similarity. There's just a couple of differences regarding evaluation and testing, and then also as an administrator, how you would grade, how you would evaluate your professional. So just kind of keeping that in mind. For more information, there is a link at the end of this slide that PISHO, the Pennsylvania Speech and Hearing Association, highlights. So basically, what your speech pathologist would need to know. It's kind of the presentation is from the Department of Ed, but it's geared towards helping your speech pathologist figure out how to get paperwork and your certificate validated. But this is a good thing too for a administrator to review, of just like, oh, what kind of certificate do they have? Do they have speech and language impaired pre-K to 12, which is that instructional, or do they have that educational specialist, which is a little bit different? But again, both are going to be helping with communication in the schools. So with that being said, I wanted to kind of go over the American Speech and Hearing Association a little bit more in depth, just because, a certificate versus licensure is a little bit different in what that looks like. I've also put a link here to the American Speech and Hearing Association with a little bit more information. So definitely, I would definitely encourage you to utilize that resource, not even just for working with speech pathologists, but also for getting information about communication disorders, and also giving resources to parents to use this as well. Again, this is a national credentialing professional and scientific organization. So again, not only are they holding up a code of ethics in continuing education, but this is also a resource for your speech pathologist to access evidence-based practices. The ASHA works with speech pathologists, audiologists, SLP assistants, and speech and language scientists. So just keep that in mind for other professionals you may work with, especially audiologists or assistants. We won't be going into that profession as much on this slide or this presentation, but definitely reach out to Patton as there may be some resources that could support you if you have any questions about that. Again, as I said, they hold a national code of ethics. Pennsylvania holds its own code of ethics that speech pathologists need to follow. You'll see some big similarities in those two. So that's always something to keep in mind, though. Provide clinical competence certificates to the CCC. So when you see your speech therapist signing things, that's what that CCC SLP means. Before you get your C's, you might see what's called a clinical fellow, which is somebody who's starting off in that 9-month rotation. You might see a CF SLP, which is a clinical fellow SLP. After that 9 months and going through that certification, you can change that to CCC SLP. Again, this is an organization that not only helps with continuing education, following a code of ethics, but gives you resources that you're able to use in the field. It's something that is very, very useful, especially for speech pathologists looking for an organization that would be able to help you navigate through certain items, such as a particular case that may be a little bit difficult, research on a specific treatment, and so forth. So it's a good resource to have, not only as a speech therapist, but as leaders in speech pathology as well. So this is kind of my favorite part, actually, of this presentation, which is a little bit of history for speech pathologists. The American Speech and Hearing Association is celebrating 100 years of its legacy, impact, and possibilities throughout its existence, and have documented what speech pathologists do in the field, as well as how it kind of evolved over time. So it's been 100 years actually from the time of this recording. So this is 2025 at the time of this recording. And American Academy of Speech Correction was founded by Robert W. West in 1925. If you read about it, it's really interesting. I put the link up there, but basically starting off as people that were interested in communication, which is really, really neat. A lot of really great resources there. As you can kind of see with the timeline, I may skip over some years, but it went from almost 1936 to publish the first journal article that they had. So something that talks about the American Speech and Hearing Association and communication. Also 1939, getting their first female president, Sarah Hawke, which is really interesting as well, being a male-centered occupation to a female-centered occupation. Nowadays, where about 9% of speech pathologists are male. I'm definitely an outlier as well, but I think it's really interesting seeing that variability, especially coming from 1925 to evolving to today. The certification wasn't established until 1952, and then also in that same decade, opening up the first office. So very recent. I mean, speech pathology is a new field, a newer field, not brand new, but it is a newer field, which is really interesting. So you'll start to see too that speech pathologists, the field of speech pathology has changed dramatically over time in correlation with a lot of the laws and regulations that were being passed in America at the time, such as, again, 1964, the Civil Rights Act. Civil rights laws established to prohibit segregation in the schools, especially those receiving federal funds, which was a huge turning point, of course. ASHA hires legislative advocacy, so looking at that advocacy for speech language pathology in students and adults with communication disorders. Skipping over a couple years, but really 1975 and 1990, focusing on IDEA being established and ADA being signed into law. I'm going to go into that a little bit more, but just keeping that in mind, that's not, in the grander scheme of things, that's not that long ago. Especially when it comes to serving students with disabilities. And I would really take the time to look at that. And as educators, I'm sure you've learned, and leaders, you've learned about that, but really taking a look at how that's evolved is really, really interesting, and how speech pathologists play a role in that, especially in the field where it is so new and it started from, again, we're getting in 1925, getting some people involved that had similar, likes and interests to now, where it is, it is considered a human right to communicate effectively, functionally, and being able to do that in the schools, being able to do that in the everyday environment. And then again, licensure in 2012 was required in all 50 states. So, having that PA state licensure in 2012, which is wild that I'm thinking that's it's 2025 now, 12 years ago. So it's, time flies. So it's and I'm sure it's going to fly even more. And then again, we're celebrating our 100 years of service in 2025. So I know I glossed over IDEA and ADA during that little timeline I had, but I'm going to go a little bit more in depth regarding speech pathologists. So in IDEA section 300.34, related services. So speech pathologists are considered related services in the schools. They identify, diagnose, and treat speech and language impairments. They can refer medical or other professional attention necessary to the habilitation of speech language impairments. So that's a big word that's a big money word that I always try to communicate with my team as well when I worked in the schools or in preschool or anything like that. Habilitation versus rehabilitation. And I like that that word is in this legal mandate. So rehabilitation is working with a student or working with an adult, and gaining those skills back from a place that they were already at. So for example, if rehabilitation, if you break your leg, you're going to need physical therapy. That's rehab. gaining skills that you already had. Habilitation is working on using the skills that you have and getting to a functional place on the skills and abilities that you have and kind of where you're stationed at. And I think that's really, really important as not just speech pathologists, but educators explaining that to your team. A lot of the times, in the schools, we're working on habilitation, which is being able to use the skills that they already have and adapting those. So same thing with somebody who's wearing glasses, somebody who's using a wheelchair since they were, younger, somebody who is using, a walker, or somebody who anything like that habilitation component. So I think it's really interesting keeping that in mind, that this is also a legal mandate in IDEA, habilitation. We're working on giving them the skills by positive things that they already have. So just keeping that in mind. Speech language services and habilitation and prevention of communication impairments. This is also something that I like that's in this mandate. So again, we're using a lot of not only habilitation, we're using prevention for communication impairments. So we'll talk a little bit about that when we talk about MTSS and RTI. But we want to make sure that they're in the least restrictive environment. We want to make sure that they're getting a free and appropriate public education, but also in the least restrictive environment. We want to make sure that we're not being as invasive starting right off the bat. Just like, a doctor's not going to say the most invasive thing whenever you're going to the doctor's office. Oh, I have a cold. Oh, we better do surgery. They're not going to, most likely not going to say that, depending on what it is. The same thing with speech language pathology in the schools. We don't want to take them away from their regular education, but we also don't want to, we want to make sure that these students have the ability to be as independent as possible. And this really highlights that. The last bullet there, counseling and guidance parents, children, and teachers regarding speech and language impairments. This is something I really want to focus on with leaders. This is incredibly important. This may not look like direct services. This may not look like push in and pull out services, but this needs to be considered in your speech pathologist workday. I cannot stress this enough, not only with ethical standards, but also with functionality and helping those students. Again, least restrictive environment and being able to work alongside teachers and having the time to do so is incredibly important. So I really, really want to hone in on those bullet points. So that's a couple things, I guess, in this section 300.34 in related services, but this is something that's very, very important and something dear to me too, because I think it's so very important for a team and a speech pathologist to be able to do that and have the time to do that, because a lot of speech pathologists like myself like talking about speech pathology, and if they have that ability on a subjective view, if they have that ability to express the happiness that they feel when they talk about communication disorders and how to help other people, that's really, really important. And that's something that should be considered not only for speech pathologists, but everyday interaction with the team. So we'll get into that a little bit more, though, as we go through this presentation. So some other components with our practice is legal mandates of the profession, which closely tie into also our Code of Ethics, but also the American with Disabilities Act. And this was really something that solidified how important it was that communication is a human right. Communication should be attainable by anybody who is a human being and able to communicate. And if they have trouble with communication, it is their human right for us to help them and support them, and also to accept different types of communication, such as, sign language, using a device, AAC device, using pictures, and so forth. That also goes into, a TDD device, or TDD, and telephone relay services, anything like that, or sign language interpreters. That is something that has really played in, with that law that speech pathologists follow. Physical, mental impairments, as ADA and ASHA communicate with, is considered something that we would support and help with, regarding such as, in summary, regarding this particular law is, a disability can come in many different ways, as we all know. Communication is one of them that we can support with. So just keeping that in mind during this session. So at the end of the day, what does that have to do with speech language pathologists? So actually a lot, so we deal with a variety of components. I also put a link here as well for roles and responsibilities of speech language pathologists in the schools. But here are some different things that would be beneficial to know. So number one, we deal with speech language disorders. So not being able to say a word clearly or sounds clearly, having a hoarse or raspy voice, which is technically still voice, but speech, can play into that as well, but mostly like a raspy voice or anything like that. Something with hoarse, we can work on like vocal hygiene, anything like that, and make referrals as needed. We also help with fluency, so basically stuttering, blocking sounds, repeating sounds or words, and so forth. The one thing I really want to focus in on is actually language. So language in the schools, expressive and receptive language, is used in a functional level. So, we need to communicate and be able to use some type of language receptively and expressively to obtain our wants and needs. Something that really plays into the school is understanding, talking, reading, and writing. So that literacy component, that graphic communication, graphic language, where you are writing, where you are reading, interpreting messages, as well as understanding and talking, are very important, especially when it comes to language development in the schools. That's something that's huge that we do help out with, and we'll get into that a little bit more. So again, here is another link to the roles and responsibilities to speech language pathologists in the schools. We work throughout the school and through pre-K. We do work birth to 3 and with adults, but in Pennsylvania, we can kind of just focus on today. I would say SLPs utilizing IEPs, utilizing specially designed instruction. We'll kind of focus on that today. But we work with toddlers, so toddlers will be more of an IFSP if anybody's ever worked in the early intervention realm. That family plan is very important, but that moves to an IEP in preschool all the way up to secondary whenever they graduate. We help, as I said before, speech, language, voice, and fluency. That's why I was kind of talking before about voice and fluency being a little different from speech. As noted by ASHA, that's something that we work on. But again, just keep that in mind, that voice and fluency are even their own entity that we work on. And that is also marked in our roles and responsibilities as speech pathologists. We use a 3-pronged approach delegated by IDEA to qualify a student. And we also use, not only with our evidence-based practice, but to find educational relevance. This is something, as a leader in speech language pathology, that is very important to get across to your speech pathologists, to utilize this realm and to utilize this approach is really, really crucial to being able to not only correctly identify students that need support, but also giving them the correct action of what kind of support they would need, such as do they need MT as some type of other model that's not necessarily tied with an IEP? Do they need an IEP? Do they need less time, frequency, or duration? Do we need to have another professional work with that? So that's something that's really important to know. We'll talk about that a little bit later. Advocacy for language and literacy accessibility. So basically, again, we're also going to be advocating for language that is in the schools tied with literacy, especially for older, as kiddos get older. We definitely work on those pre-literacy skills for students, but as students get older, we're really going to hone in on that because they need to access their education. And that sound development, language development is tied directly with literacy and is tied directly with using literacy skills and communication skills to access their education. And then finally, making sure that we're culturally competent. Depending on where you work, one of the components to our code of ethics is making sure that we are treating students and patients, or students and clients alike, with respect, dignity, and individualized, especially with the schools, with everything being an individualized education plan. Couple more responsibilities here. Prevention of academic and functional failure. So the biggest thing is if we don't have to work on it and we can prevent a student from, further having difficulties with communication, whether it be speech, language, if we can give them the tools in the least restrictive environment, that's something that we're going to do. Assess communication disorders, intervene and remediate. That's pretty standard. We as educators already kind of know what that would look like, a therapy session. And if you don't, that's okay too. We'll talk about that. But again, we already know that assessment and intervention is a big part of what speech pathologists do. Your speech pathologist is going to work with you with program design, data collection, collaboration, and making sure that they're compliant with their paperwork, making sure they're compliant with timelines and duties that school, state, or LEA, state, and federal guidelines produce. So have an open dialogue with your speech pathologist as well to make sure that they are on the right track with that. As you can see, there's a lot of responsibilities, a lot of components that are so important. Keep those in mind with your speech pathologist, especially when it comes to some of those things such as consultation, collaboration, parent communication, that may be more difficult to do that because they have to keep the timelines, they have to keep, the therapy sessions and all that. Be cognizant of that, again, that falls, compliance, data collection is very, very important. But those other components are also important, as in staying in communication with the team, parents, and so forth. Which brings me to leadership and advocacy in the school setting and parent-caregiver report. The one thing that I always say with leaders is with parents and caregivers, we want to make sure that we're letting them know that them being in speech and language services, our main goal is to lose our job as speech pathologists. It sounds weird, but that's really what it is. We want to be able to make sure that student is functional and independent. That's the same thing in the medical model as well, which we'll talk about, but we're going to make sure that speech language pathologist is able to move that student forward independently. And being honest with those caregivers as well is dismissal is our goal. Right off the bat, we do the assessment, they need speech and language therapy, dismissal or decrease in services, it will eventually be our goal. Is that going to be every student? Absolutely not. Every student is individualized. But making sure that you're letting those parents know, listen, I want to make sure that they're as independent as possible. So working with the team and figuring out, do we have the data to support that information? So like I said, keep those in mind of the different components and roles and responsibilities that are very, very important in the world of SLP. So I wanted to also get into the evolution of SLP practices in the schools. Here are just a couple of really nice resources that you can use. Again, from ASHA, talking about the early years of language, speech, and hearing in the schools, as well as the impact. Well, saying that ASHA is a good resource, but also this information talking about how we play into IDEA and ADA and things of that nature. Again, going back to really where we started from. Again, it's very interesting being mainly an interest that people had with communication and just talking about communication to really being in the spotlight of practitioners that give adults and children modality to communicate in a way to express what they need, which is really interesting. Again, this is a huge impact, not only in clinics but also in the schools. So we'll get into this a little bit in the next slide, but also just seeing what do we do in the schools. Starting really off again. Number one, starting off with being a supervised entity from the school, of being able to provide a specialized service, to working on maybe we're just working on language, maybe we're just working on sounds, I have to go see the speech teacher, to being a speech pathologist where you're really working on fluency, cognition, articulation, motor speech, expressive receptive language, doing multifaceted evaluations, comprehensive evaluations, and being at that level of performance and professionalism and in the schools, and kind of seeing how that changed over time. And then also the verbiage that we use, which I'll kind of show in this next slide here for SLPs, right? So this is basically, if you kind of look at the SLP role, it goes from specialist, expert, collaborate, facilitator for service delivery. So it really changed from that silo, like coming to, you come to my office, I do A, B, and C, and then you're set to go. Really what we're looking at in the 2000s now is, what exactly can we do to make sure that student is able to access your education? You can take a deeper look into this when you're reading through the slides. By the way, the slides will be available with this video. So just keep that in mind. And this has I think it was a really nice breakdown of, how speech pathology has evolved since even 1970, so fairly early on in its development, which is really interesting. So again, another thing to keep in mind, you can revisit that as seen fit with your schedule and your needs. So with all of that being said, let's talk a little bit about eligibility in special education. Let's talk a little bit about what exactly does eligibility look like in the schools, especially for speech language pathologists. Earlier in this presentation, I talked a little bit about the medical clinical model as well as the educational model. I really wanted to go through that because this is a big question that comes up a lot as an educational consultant with Patton, as well as when I was a practicing speech pathologist, which was not that long ago. You know, there is such a big difference. So looking at the clinical model, let's look at that first. So discrepancy model, you're using the therapist discrepancy to work with the client, or basically work with the client, what they're using evidence-based practice, of course, but again, you're using more of a discrepancy model. Cost depends on insurance, so you're going through insurance a lot of the time. Qualification may be a little bit more flexible. So when you're in the clinical model, a lot of the times we may hear they qualified at this clinic, or they qualified outside of school, but they're not qualifying in school. Why is that? And we'll get into that under the educational model, but that is definitely a big question a lot of people ask. Recommended frequency and duration is very different. Derives off of insurance, usually. Derives off of what the patient needs as well. The evaluation occurs in the clinic right then and there. Scheduling and availability also depend on, sometimes I've heard of places months or multiple months, out where they can see a student or see a client. And most often it's a block of time. So, 1 full hour of that particular services. And this has to do with a lot of related services as well, but definitely with speech pathology. On the educational side, however, it's part of a free and appropriate public education. So it is mandated by IDEA. It's part of that mandate. So we're keeping that in mind. And it must have an educational impact. So it must affect them educationally to qualify for speech and language therapy, which is where we'll talk about the 3-pronged approach here in a little bit. It may consist of direct and indirect treatments. So I'm going to say that again. Consists of direct and indirect treatment. It is not just direct treatment. It is not just 30 minutes a week in the speech room, right? It's going to be so important to keep that in mind. That therapy delivery can look so different depending on where you're at, what the student needs. I mix up client and student sometimes, so just bear with me. It all depends on that individual need, right? And it could look indirect, which we'll talk about. I know I say that too. We'll talk about it. So the service for the educational environment is going to be in the school environment. That's where it needs to be, or in the educational environment, right? So services could occur in the home. Services could occur at the therapist's office, in the classroom, and so forth. Frequency and duration are based on student needs, as well as balancing access to the least restrictive environment. So always keeping that in mind. Are they in the least restrictive environment? Are they able to do what they need to do as students in the special education realm? Are they being pulled out of class too much? Are they being not pulled out of class enough for speech and language therapy? And do I really need to pull them out? Can I just push in? And then also based on a team decision. So clinical, you're really looking at the parent and caregiver needs, as well as what the speech pathologist says. But again, a lot of times in the educational environment, you have the LEA, which is the LEA representative, which could be a principal, somebody who's familiar with the financial and regulatory components of the local educational agency. You have the parents, of course, regular education teacher, special education teacher, speech pathologist, and so forth. So keep that in mind as well. So this is going to be a team decision. And the student, the student is also a part of the team. So we talked a little bit about education versus clinical. So let's take a step back and look at some of the goals for a school-based speech evaluation, right? So we want to determine if the student's communication adversely affects academic achievement or functional performance. So from the data that I received, not just from standardized testing, but parent teacher history, skill-based assessments, observation, other interviews, a case history as well, educational history. Do I have enough data to support that they need support with accessing their education, and is their disability affecting them academically and functionally? So after we do that, we say, okay, we need to determine these goals for that communication disorder, to make sure that we're remediating what is affecting them, academically or functionally, right? And then finally, one of the most important parts is to dismiss the student from speech language pathology once that criteria for eligibility is no longer met. So again, right off the bat, and I say this in all of my eligibility information, I've run by this in the speech as a speech language pathologist. Dismissal is the goal. Independence is the goal, and communicating that with your family early on, depending on the student, that is really what we're looking for. And that's going to be huge, especially for parents who are new to the evaluation process. They most likely will be, because, depending on a reevaluation, of course, depending on where they're at, they need that information, right? So these are kind of the goals for a school speech and language evaluation. Again, are they affected academically or functionally? Let's determine goals and what is the dismissal criteria for those goals. And not only staying in contact with the team that we discussed before, but also staying in contact in the state of Pennsylvania with your special education supervisor for your school, your supervisor in general, and your BSE, Bureau of Special Education advisor as well. So staying in contact with them, if needed or support is needed with some of those regulatory components. Okay. So with all of that information, how are we going to measure a student's need for specialized instruction? Really looking at this three-pronged approach to educational abilities. This, again, is part of the IDEA federal guidelines, but really looking at these three components and also them meeting these three components, which we'll talk a little bit about. But let's start with number one. So diagnosis in one of the 13 disability categories, such as speech and language impairment, autism, or other health impairment. So there are 13 disability categories the school can use to be eligible for special education. So that's really the first step, establishing, okay, is there a disability? Number two, documenting what educational impact. So using a comprehensive assessment, using multiple people to tell you what's going on, multiple sources of what's telling you what's going on with the student, and then going from there and helping as needed. And do they need, again, specialized instruction for that help? Which is the third part, okay? So again, a diagnosis, documentation of educational impact. So from my data, it shows that this is impacting them educationally and functionally in the schools, so they're going to need some support. And then also, is it necessary for them to receive specially designed instruction to get this? So some examples where this could break down and they would not qualify for speech and language therapy or special education in general is, let's say, okay, there's something definitely going on there. This is an example I'm giving. There's something definitely going on there. They have some type of articulation problem, so this would be, or articulation impairment, where they're saying a certain sound a little bit off. But from the data that I've collected, they're having good grades. They pick up on prompts from their teacher when they need to be recorrected. So let's say they can't say their R's. The teacher's able to recorrect it, but they forget how to do it sometimes. Okay, that's fine. And they are very active. They're doing what they need to do in class. They're hanging out with other kids. They're excited to come to school. So they're not necessarily meeting that educational impact. So as a speech pathologist in the school, I'd be like, no, you could always keep an eye on that student, and then we can come back to that at a different time. So that is how educational impact could work, and then also necessity of specialized instruction. So let's say that, yes, this isn't affecting them educationally. I think there are some other things that need to happen beforehand. But do they need a speech pathologist either consulting? Do they need a speech pathologist pulling them out of class and working with them, going into class and working with them? And let's say the student, for example, our student is he or she has some difficulty with that R, but we aren't necessary. A speech pathologist does not necessarily have to work on that. You can provide resources, you can provide talks with the family, saying like, hey, let's monitor this and keep this, this student is definitely on my radar. Do we need specially designed instruction? Because it also could be something that can be worked on with the whole class, which will kind of go with the MTSS model that we use in PA. Maybe we can add this into that, or maybe they can work on it, in certain times of the day, and doing check-ins. But does it really require a speech pathologist to pull them out of class, collect data, have IEP meetings, and put them on put them in a more restrictive environment? That's not always the case. So again, all three parts of this approach must be met to qualify for special education. Again, they need a diagnosis, documented educational impact, grades, social interactions, a functionality in the classroom, and does a speech pathologist need to pull them out to provide specially designed instruction? Is that something a speech pathologist needs to do? And this could also be with a student, maybe that the speech pathologist is a related service. So the student already has an IEP, they're already, working through some of the things that they need to work through and require specially designed instruction, but a speech pathologist might not necessarily have to be involved with that. They might, even at a consultative level, or even of just saying, again, communicating with that teacher and saying like, hey, if that teacher asks you a question of just like, okay, here are some resources, I don't need to step in at this time, but here are some good resources. So again, this three-pronged approach of educational ability is very important, is part of the federal guidelines. I would also recommend to my speech pathologists and supervisors of speech pathologists in Pennsylvania, reach out to Patton regarding these items to talk through some of these. We can't give you eligibility criteria at the time of this recording for LEAs. LEAs are tasked with making their own eligibility criteria while following federal and state guidelines. But we can always walk through what eligibility looks like. We can always walk through maybe some support with a specific problem or a specific case. You can always reach out to us and we can help out with that. But just some information there for you. Moving on, I wanted to talk a little bit about Penn data. This is just, again, a little quote from their main homepage. This is run by PASDC, so PSU is in charge of a lot of the data analysis that goes on in Pennsylvania, especially for students. This website's exclusively under the contract of the Bureau of Special Ed. This is the information that you can use to see annual federal data reports, data management, public reporting, as well as look at indicators such as graduation rate, dropout rate, and student participation as some examples. This is all information for special education and is sent also at the federal level to really monitor how the state is doing. Pennsylvania addresses the state level reporting requirements by disseminating SPP and APR to the public, and making sure that the state's progress or slippage is meeting measurable, rigorous targets. So these are kind of different ways that Pennsylvania kind of keeps himself accountable. But again, this is just something that does apply with speech pathologists too, because that is also looking at their performance, how many students in Pennsylvania are receiving speech and language services or fall under the category of speech and language impairment. So definitely look at this site more. I'm sure you have to interact with it as a supervisor quite a bit, but just knowing that this is also involved with speech pathologists as well. So we have qualified a student. They have fallen under that three-pronged approach, and now services should be rendered, right? How is that going to look? What exactly are we going to be doing for those services? The next couple of slides are going to be information about different service delivery models and what they would look like. The one thing I really wanted to start off with was MTSS and RTI. I have had a lot of questions about this in the last year or two about using this MTSS RTI model. To go a little bit more in depth, there are multiple resources on the patent website, which I've put the links up here, as well as some tools that would be able to help with fidelity. Your school district or LEA may already have an MTSS or RTI model established. I would strongly encourage you to get your speech pathologist involved and to also reach out to patent to see how your speech pathologist can get involved with MTSS and RTI if they're not already doing so. So it's very, very important. But I definitely encourage you to check out these links, again, on your when you have some time throughout your day. Very, very informational and kind of gives you a good rundown. I'll try to go through some things here as well, but this is, straight from the horse's mouth, so it's very good information. With MTSS, it's a three-tiered model. Pennsylvania models include tiers 1, 2, and 3, levels of support. Tier 1 is universal, class-wide intervention. Speech pathologists can definitely be part of that. They can be a part of making sure that there's language-rich environments in the schools, making sure that there's soundboards, making sure that there's evidence-based practice, and also just answering questions. So having the time to, answer an email and saying, like, I have a student that's doing this, I need support with that. I don't need to do a full evaluation necessarily. I just, okay, let's check it out and see what we can do. But having a specific plan tied with that. We don't want to necessarily delay an evaluation if a student is showing a need for specially designed instruction. That is not what we intend to do. But again, making sure that they're in the least restrictive environment and make sure that there's some type of intervention that's being provided. Universal class-wide intervention, again, working with those regular and special education teachers as a speech pathologist is very, very important. Ensuring that meaningful access to high quality standards aligned core instruction, so targeted support, so more targeted intervention for students. That's kind of that second tier. Again, speech pathologists can be part of that. Maybe working with a targeted group of students, depending on what your MTSS model really looks like. Then moving into tier 3 or intensive support. So like 3 to 5% of students offer most intensive level of support and services. A couple things with MTSS, they're not a precursor to an IEP. So a lot of the times educators are like, oh, put them through the MTSS model. And then if they don't hit that, we're handing them an IEP. So just remember that they all coincide with each other. Depending on what that package is, they could have specially designed instruction with part of the MTSS model, depending on what it is. So just keep that in mind there. And then, like I said before, we're not delaying specially designed instruction if needed. We are making sure that we're meeting that student wherever they're at, especially when it comes to that tier 3 intensive support. So again, with the MTSS model, tier 2 and tier 3 we're not replacing or compensating for a weak or inconsistent tier 1, right? So even within the model, we're making sure that that's really where the student needs to be. And if we need to move them, we're doing it proactively. Um, Evidence-based and data informed. So really working with your speech pathologist and your team to make sure that they're using evidence-based and data-informed intervention at whatever level that may be, even if it's just giving resources to the teacher for them to do. Even maybe a small, training of like, this is how you elicit the sound, for example. Making sure that you're using data-based decisions and it matches individually with those student needs. So again, your speech pathologist, if we're following this three-pronged approach, and if we're following a varied delivery of services where MTSS and RTI would be considered that, especially if a school district is using an evidence-based MTSS model, you're going to find the availability to go through your speech pathologist to go through and communicate what exactly a teacher could be doing, what exactly a group of students may need, and then measuring when and what interventions a student may need. So just keep that in mind. And then tied in with MTSS, as well as any type of intervention in the schools, is RTI, a response to intervention. I'm not going to get too in depth with that. However, I want to really reiterate that speech pathologists in the schools should and can be involved in this process as well. Looking at the growth of a student, are they making sure that their performance level isn't going too slow, or do we need to up the support or decrease the support? Does there need to be something different depending on their rate of improvement, growth percentiles, what is their mastery? In Pennsylvania, the RTI approach is used a lot for evaluating specific learning disabilities. Again, that can involve a speech language pathologist as well, especially when it comes to the continuum, not just initial or ending parts of services, but the continuum of services that can be offered in the level that the speech pathologist can help with. So just be cognizant of that your speech pathologist can be involved with that. And if you do have any questions, you can always reach out to Patton. Myself included, we'll kind of go over that as well, especially when it comes to reaching out to consultants in the different regions of Pennsylvania. Some information about school-based speech and language service delivery. Three big categories that you would look at as a speech pathologist of how we are going to provide those specific services. So number one would be format. This would be the type of session that would be happening. So one-on-one or individual, which tends to be a little bit more restrictive, for students that do need a lot of support, or that need specific specialized instruction that's communicated through the IEP team. In a group, as a practicing speech pathologist, I didn't like doing, depending on what is said in the IEP and with the groups, I didn't like to go over 4. Really staying away and also advocating as a speech pathologist, I really don't want to have a session over 4 students, depending on what the IEP says, what the LEA's policies are, but I would really try to advocate for that, because as a speech pathologist and as a student, it's not necessarily more the merrier. It's granted, there are certain times that a speech pathologist would be needed to see more, such as helping out, supporting more students. But I would say, a good rule of thumb is not keeping it over 4, and that, talk with your speech pathologist about that too. The second thing would be dosage. So the frequency, intensity, and duration of services. So the number of treatment sessions over a set period of time, so twice per week. The intensity, the amount of time, could be 30 minutes per session, and then duration for like a year, for once a week for, 1 semester or 2 semesters or a full year. So dosage, again, we're going to talk a little bit more about how this varies as well, and that it is good to have varied dosage formatting and having different settings. So, when you look at a speech pathologist caseload, it should really look very, diverse in regards to format, dosage, and setting, which we'll talk about. And then finally, like I mentioned before, setting. So the location, is it home, community-based, pull-out, push-in, consultation? So that is another thing that you'll kind of see. And again, that should vary as well. And that changes with the IEP. We don't want to change the IEP too much, but as the student gains more skills, all of these things are liable to change. And communicating that early on is very important too. So just keep that in mind. In more of an in-depth analysis, let's look at dosage format. Okay, so dosage being how those services are delivered. Again, duration, frequency, and the length of those services. So again, the biggest one that you'll kind of see that I mentioned before in my slide previous to this was the traditional schedule. So 1 time per week for 30 minutes per session, or 1 time, 90 minutes a month, once per cycle, or blah, 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 the traditional cycle, that's usually how it would look, so even if you said 90 minutes a month, it would end up being, what I was kind of saying before, of just like, having those 30-minute sessions, and then, maybe with a 3-to-1 model, having that 1 week to do more of that indirect service, So this is the one that's being used the most, having a small group, individual classroom-based sessions. This is not a bad dosage format. This is not a bad schedule. It's just used a lot. And the one thing I really want supervisors to take away from this is that doesn't necessarily mean this is all it needs to be. This is not the only thing that it needs to be. Number 2 would be reseeding. The SLP initially provides intensive direct services. So it could be once a week for 30 minutes or twice a week for 30 minutes, anything like that, and reduces while increasing indirect support or independent practice and generalization. I love this one because it gives you that option early on, saying, hey, we're going to slowly try to back away and give so-and-so the help that they need by giving them the independence that they require. We're going to start out hard and heavy, and we're going to be, really working towards empowering them and offering them that specialized instruction, and then slowly fade away and making those changes as needed, not necessarily saying like, one and done, as you can't necessarily just say like, we're not going to ignore the data. If they need more support, then we need to follow that data. But again, that preceding direct service to more of that indirect support is part of that receding dosage format. And then number 3 being the cyclical format. The SOP uses a service model as like a 3-to-1 model, providing direct services for a set period of time, like 3 weeks, followed by a week of indirect service, focused on monitoring, collaboration, observation, consultation. Now, the one thing, and you can hear my hand kind of hitting the background a little bit on my desk, so I'm passionate about this. The one thing I want to reiterate to supervisors is that 1 week off is not time off for your therapist. So I'm going to repeat that. The 1 week off is not time off for your therapist. Your therapist is not taking like downtime for that and just kind of working on whatever. This is time that the speech pathologist can, again, focus on those indirect services that they provide your school and help your students. Again, this could be anything from IEP meetings, consultation, parent-teacher collaboration, report writing, medical access billing, anything such as that, helping out with that model. Transparency is your biggest friend, as you already know as a supervisor and as a special educator, of just saying, like, well, what's going on? Like, how is this week going to look and how can I support? And trusting in your speech pathologist of saying, like, okay, you're still working to help the students on your caseload, but you now have the time to do so during your day. And again, you may notice that there are still certain things that your speech pathologist needs to do and may need support with, and you have that conversation with them. But this gives them a nice leadway. I know for me, sometimes I would even try to do makeups if I was able to during that week. That's another thing. I was able to write a lot of reports, touch base with a lot of teachers, observe as needed. With that consultative model, you can put that in there of observing and also analyzing data, which I think is really important too, because we make such in the moment decisions based on data, and it gives you this week kind of gives you that ability to analyze, especially for new clinicians. So again, also thinking about these 3 dosage models, not only for the student, which is the number one priority, but one of the other priorities is making sure that our speech pathologists and our supervisors and our educational team is well equipped to deal with the environment of special education and also education in Pennsylvania. So keep that in mind. We're going to continue a little bit with dosage. So block schedule, speech and language sessions. A lot of the times, secondary schools have longer schedules, like longer blocks of time. So big blocks of time, but less frequent, aligning with those block schedules. So almost not to compare to the cycle's dosage format, but the cycle schedule in a school, one time per the cycle for maybe 45 minutes a session or something to that effect. So you're spending more time on that. This is, again, a broader sense, and depending on what your speech therapist and student needs are, that may change. But we see this a lot in the older grades because there are such big blocks of time that happen during the day. Blast burst schedules. This schedule delivery is short, frequent bursts, so 15 minutes 3 times a week, and enabling support with minimal travel and reduced times out of class. So one of the things I think of is speech sound therapy, working on those big blasts 3 times a week, and sometimes fading that as well. Again, this is something that might not be for every student. This is, again, something that, again, very intensive, 15 minutes 3 times a week, boom, 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 and then making sure that it's quick. A lot of the times I see speech therapists, to get those 15 minutes in, they either do it inside the class, push in, work direct, maybe a little bit out, like very close to the classroom, like if there's a space outside. So this is another kind of format that's been pretty good. Another thing just to keep in mind is group size. Keep that in mind with all of these. So based on the needs, factors, grades, abilities, IEP goals, ASHA policy, state policy guidance. Again, like I said, it's very much so. It's very important with dosage of the group size, and it could change, individual and I wouldn't go anything north of 4. 5 is a lot. Depending on the kid, a lot of kiddos to treat. And keep that in mind. And if your speech therapist finds them in that quarry of like, I have so many kids, talk with them, communicate with them. How can we make this work? And talk with the team. You're not alone. You're not working in a silo. This is very important to establish that right off the bat. Okay. The last one, which is one of my favorites, is indirect or consultative services. This is sometimes a difficult conversation to have, of saying consult and indirect services is not less than. It is not something that is taking away from the student. It is a different type of service delivery dosage, service delivery model. So the SLP collaborates with teachers, staff, and families, adapt materials, support AAC use, attend meetings, progress conducting assessments, planning intervention, coordinating with educational teams, right? So if this is on an IEP, that is part of your day. If this is on an SLP schedule, that is part of their day. This indirect model can work with that 3-to-1 model. It can work with some of the other schedules as well. But consultative, just like MTSS, it can be a determination that the services are slowly coming to an end or finally coming to an end after a while. But this is also just a level of service delivery that is very, very important, especially when it comes to students that may not require direct services, that may not be able to do direct services. There have been many times where a student would benefit more with a speech pathologist directly consulting with a teacher or parent. And especially with AAC use in combination with direct services, sometimes with AAC use. So you see that as well. So maybe some consult put in with that direct service. I would say, again, each LEA is going to be different. These are all recommendations. These are all different styles, and this is all individualized. Stay in contact with your BSE advisor. Stay in contact with your speech pathologist, and stay in contact with the team as well to see what works, what needs to be changed, and what can stay the same, what's working really well, and notify that with your speech pathologist. I've had good feedback. I was observing this day and you did a fabulous job, A, B, and C. You already know to do that, but this is another thing to recognize sometimes as well in this process. With all of that being said regarding dosage, format, and different scheduling, the one thing that I think as leaders and supervisors in this field, especially when it comes to speech and language pathologists, is becoming familiar with the Pennsylvania Department of Human Services School-Based Access Program Handbook. I'm not going to go too in depth with this, but this is just some information and where to find the handbook. This is linked in the slide. Again, these are all little things that really add up, and making sure that yourself and your speech pathologist are familiar with the Pennsylvania Department Access Program Handbook. If you have any questions, you can always reach out to us, but this is a resource available to you. So I have all of this information. How am I going to manage this? What is it like managing an SLP of even 1 to maybe 50, like in the IUs or a bigger district, or 5 or whatever number? So what is next? How am I going to do this? A little bit of information for that. So patent is part of the attract, prepare, and retain initiative that is being led from the BSE and down to Patton to help out with that initiative. So we're trying to attract skilled, compassionate people in this career of special education. As we all know, there has definitely been a decline in special education professionals in the schools, especially those becoming certified. It is tough. There's a lot of obstacles and challenges everybody's facing right now, including myself. So we're all definitely feeling the pressure there. We're also preparing special education personnel, so we're building capacity through professional development, technical assistance supports. So that preparation component, that's something again that we can help out with too. Making sure that we are hiring competent workers, but also making sure that we're training them into the best of our ability too, and taking that responsibility of making sure that we have excellent professionals in the field, and then retaining them. I want to keep my speech pathologists. I want to keep my special education teachers or psychologists or anybody like that, which I haven't mentioned too much during this presentation, but are very important. This is something that's through Patton, either way, Patton usually. This is something that is being led through Patton and is a very important component that, as a supervisor, please keep that aware in your mind, in the back. Please be aware of that and keep that in mind in the back of your head, in the back of your mind, that this is something that has been going on from the BSE that's being led by Patton. Again, more information on our website, or you can reach out to one of your consultants. So here are some links for the Patton website and for the Bureau of Special Education website, and some infographics about APR. One of the ways that the Speech Language Pathology Initiative, or Speech and Language Initiative, is being involved with APR is, again, making sure that we're giving guidance to graduate master's level students coming into the field, staying open to communication to other speech pathologists in the field, providing guidance, providing different incentives to make sure that we are attracting, preparing, and retaining professionals in the field. Just some other resources for you. Why this is so important is, if you're kind of looking at this graph of speech and language impairment pre-K to 12 and school-age speech and language special educational specialists, it has decreased a little bit, and we are losing, especially in the 2022-2023 year. It went up a little bit more, but I mean, from 470, 418, we are getting less professionals each year that are obtaining these certifications. So that's definitely something that's concerning. Again, getting a little bit better, as you can kind of see, but from where it was back in the early 2010s, it's something that we have to keep our eyes on as well, especially when it comes to that speech and language impairment certification. That definitely seems to happen a lot less. A lot of speech pathologists are going for the ed specialist, which is a different certification, but that's just something that this graph, of course, shows. Again, why we are doing the APR initiative. Now, with that graph that we looked at, one of the biggest things, at least in the world of speech pathology, there are some components that are adding to the decrease in certification that I won't get into today. But one of the things that a lot of ASHA and PISHA, which is the Pennsylvania Speech and Hearing Association. I didn't mention that as much in this, but this is another resource that I've linked at the end of the slide. Definitely check that out. But looking at a caseload versus workload model. This is what I was talking about before, of making sure when you are working with your speech language pathologist that you are keeping in mind that direct service and IEP meetings are not all this person is doing. They are doing prep, they're writing reports, they're doing progress reporting, they're doing evaluations, they're writing up service logs, notes, attendance. Everybody's busy in the schools. Completely understandable. But if we have the ability to do something easier to make our educators or speech and or speech pathologists' lives easier, then we should do it as leaders, right? So, according to ASHA, taking a workload versus caseload model is very important. So, oh, they have 50 kids. They have room for 15 more. Not necessarily. It could be students that are receiving high dosages of services, or, oh, they have 45 kids. They could be between 3 or 4 schools, and they could all have a lot of needs. So keeping that in mind, the biggest thing I would recommend with this is being upfront in communication with your speech pathologist. What does your caseload look like? Having access to that. How can I help? How can we move some components around to make sure that you're able to get the work done that you need to get done? Because at the end of the day, the one thing that is going to help attract, prepare, and retain is having a community understanding of the workload model of we have other obstacles and responsibilities. I shouldn't say obstacles, but responsibilities that we need to do. There are obstacles throughout the day, of course, that you have to keep in consideration. But again, we have other responsibilities that we have to abide by, whether it's access, billing, treatment, traveling, anything like that. A caseload model is not something that works with a speech pathologist all the time. It's something that adds to burnout. It's something that adds to maybe that retention component. Some people can't do, some speech pathologists do become burnt out. And this is one of the ways that might be able to help. So ASHA does, this is again linked to this slide, ASHA does talk about this. But as an educational consultant, I would say communicate with your speech pathologist right off the bat. What does your caseload look like? What is it going to look like throughout the year? Are you going to get more students, especially if you're a speech therapist that works in kindergarten? That initial, 3 or 4 or 5 months, you're going to get a lot more kids, especially, well, not just kindergarten, but all the way up to 3rd, 4th grade. What's the plan for this kid? How can I support? You're very busy as a leader. I understand that. But this will go a long way of acknowledging that workload versus caseload model, becoming familiar with that, and keeping in mind all of the other things that you need to do as a speech pathologist, and all the things that your speech pathologist does for you to make sure that behind the scenes these students are succeeding, and that your parents and caregivers are also succeeding and are happy with where they're at. And your speech therapist is happy because they have the time. Thank goodness they have the time to get the work done. And being upfront with them of what you're able to do with them and what might be something that you can support them with at a different time or throughout this process. So that's pretty much the biggest summary. Again, if you want to go to ASHA and read a little bit more about that, I definitely recommend that. But again, considering the workload versus a caseload model, it's very, very important to keep that at the back of your head. A deeper dive into some of those issues. School-based speech pathologists serve a diverse population of students. right? So we're working with students with under IDEA, so with disabilities, which has many legal mandates and timelines and guidelines that we have to follow. Caseload of 65 kids, that's a lot. That's a lot of things to keep in track. I don't care who you are or what you're doing or where you came from. That is a lot of stuff to keep track and doing it accurately. So, keeping that in mind. Students with 504 plans. So, those specific students that are in that 504 plan where they're receiving some type of intervention from you, not necessarily an IEP, but again, a 504 plan, preschool age children, so doing screenings. That's another thing I didn't mention too, is screenings, universal screenings, student receiving early intervention services through MTSS. That's huge. So that's another thing, keeping those key issues in mind that um, larger caseloads can negatively impact student performance and speech therapist outcomes. Um, very, very important to keep that in mind. So, as an administrator or supervisor, what am I supposed to do? What I have a school where there's only one therapist, and there's a lot of kids on on the speech that receive speech and language therapy. What am I supposed to do? ASHA recommends the workload model. This is a good place to start, right? Baby steps. We're all in this together, and we're all a community of educators to work to help these other students and to help their community, right? So, looking at a workload model, these duties include direct therapy services, compliance related tasks, collaboration with staff, professional training, conducting workload analysis by helping identify workload imbalances, advocating for staff, and optimize service delivery models. Whew, a lot of stuff going on there. So, again, workload analysis is going to help. And the workload model is going to help the speech pathologists give better direct therapy service, be compliant with related tasks that the school district needs to be compliant with, federal, state, and LEA mandated regulations. And it's also going to help optimize service delivery models, whatever they may be, and be able to do varied service delivery models, which is what ASHA and the state of Pennsylvania wants your speech pathologist to do. So this is a good step. Workload model, taking that analysis. There is a workload model calculator at the end of the slide that ASHA has, and a demonstration on how to do that. I will put the link at the end of this presentation. Um, it really gives a nice breakdown of what your speech pathologist needs to do. Some things that might help with a caseload versus, a workload model. So, helping the SLP manage things as an administrator, you mean a lot to your speech language pathologist, because when they're the only one in the facility, or they're the only one that is or when they first start, they're looking for your guidance and support. So really looking for that administrative support is key. Flexible scheduling models, so that 3-to-1 model that we talked about for delivering services, utilizing a speech and language pathology assistants whenever you can. That's a whole other thing that I won't get into as much, but that is a possibility of having SLPAs help with those workload components. Leveraging technology, so using technology in your benefit. Some speech pathologists use, for example, data taking apps and stuff like that. Like if there's an articulation app, I forget what it's called right now, but whenever you work with the student, it takes the data right there and making sure that it's private and obtainable by the speech pathologist, and then they put that into their data tracker for that student. So that's just an example. And then applying proper eligibility criteria for services. So again, with the workload model, you'll have the time to determine, does the student need specially designed instruction, or can we go another route? Resources, working with the classroom teacher, consultation, and so which is consultation would be considered specially designed instruction. But what level does the student need some support? Another thing that this would promote is legal and professional compliance. So making sure that your speech pathologist is meeting those timelines, is meeting the building rules, state, federal rules. This gives them the time to do so. This gives them allocated workspace. And if your speech therapist is, invite your speech therapist to be upfront about that. Invite them to be upfront about, I need support. When am I going to do this? When am I going to write this report? When am I going to have this IEP meeting? I have all this data and paperwork. I'm not going to have time to put it in A, B, and C. Be upfront with them and be proactive with them, because it will go a long way. And that's something that's very, very important. So professional and legal compliance, of course, and again, that is very important, but being upfront about that. If you need support with that as an administrator, because as a team, you're all responsible for that student's improvement. So making sure that your speech pathologist has the time and resources to complete those legal and professional compliance components, so that they can treat and have fun with the students and have more of that joy of teaching and joy of therapy. Making sure that the legal and administrative component is taken care of, so that they have the time to do what they need to do with the student, and have fun and enjoy what they're doing. Equity in services, so making sure again that not every student is getting 1 minute or one 30-minute session per week. Every student gets this, or 90 minutes per month. Every student gets this. And not every student needs that. So this allows that workload components to vary that, and allows your speech pathologist to vary that service delivery, because again, also tying in with legal mandates and compliance, individualized education is what we're going for in the least restrictive environment, right? Positive student outcomes. So a lot of what is being seen is that workload model is giving positive student outcomes, more independence, better abilities to better resilience with these students, and better outcomes. And then finally, retention of SLPs and qualified SLPs. You're allowing your speech therapist to thrive. You're allowing your speech therapist to enjoy what they're doing. And with that is happening, those are better outcomes, just like with any other education. in the schools or a job in general. So keep that in mind. So this is just another link to the Public School Code 1949. I'm not going to get too into this, but this is regulations relating to employment and reporting of school finances, measuring student outcomes, and so forth. So formerly known as Title 24. Again, this is something that I would review as, or that you've already reviewed as an administrator. I'm not going to get too into it, but again, you can always reach out to Patton for further support. And then here are some links for some additional resources for you. From ASHA, Core Common State Standards, Common Core State Standards, Patton for the Speech and Language Initiative, as well as OSAP and Rights Law. So again, this is a really good thing to review as an administrator of how that can affect your speech language pathologist and what they should be doing in a workload model. And then here I want to review teacher effectiveness. So as an administrator, being able to use the Danielson model to evaluate your school-based speech language pathologists, how that might vary and how similar those can be with your teachers, psychologists, and so forth. I'm not going to get too in depth with Act 13 in 2020. I'm sure as an administrator, you're already aware of what that looks like. I did add a link here as well for some of the Commonwealth information, classroom teachers, information, temporary employee versus, other professional employees. And this also has some good information regarding using evaluation, the Danielson model to evaluate professionals. So diving right into the domains, we're going to start with preparation and planning. So again, a lot of these are going to look very familiar. A lot of these are going to look, similar to working with a teacher or another educational professional, but just some things to keep in mind. So with this particular first component, we're looking for the speech pathologist to have extensive knowledge and skills of that therapy area and hold the professional and ethical standards that are tied with being a speech pathologist. You can always reference ASHA, PISHA, as well as the Department of Ed to make sure that that's happening. Again, with some of the speech pathologists, what we would look for again is demonstrating a thorough knowledge and holding the necessary certificates or licensure, which is really, really important. Again, as working in any school, in any profession, you might see some basic knowledge holds the necessary certificate or licensure, but still needs to brush it up on that. So with that needs improvement. And then also there might be speech pathologists that don't have that and may need a little bit more support in the therapy area, or that don't hold a certificate or license, where you would have to go back to review that information as well. Establishing goals that are appropriate for the setting and for the students, so they're having good goals. Knowing the special education laws, procedures, and taking leadership role in reviewing and revising as needed with the district. We're going to look at making sure that they're demonstrating a lot of knowledge and resources, and they're demonstrating a lot of knowledge, but also have resources for the school district or larger community. So again, I'm really highlighting the community-based intervention in the schools and keeping that in mind, not always following a community approach, but also using community. Your speech therapist is taking that into consideration, your community, where the school is, the students, the families, and so forth. Meeting the students' individual needs, as well as developing evaluation and therapy programs for that school, making sure it's highly sophisticated, multiple sources of evidence, and IEP revision and creation based on this qualification data. So again, a lot of these things are going to fall on your speech pathologist to do, but these are some of the things that they may need support with that you see in their evaluation plan that you can really highlight. So just keep that in mind. So the next one would be the educational environment. And looking at what the speech language pathologist is doing to make sure that the environment is appropriate for your students. So you're going to making sure that number one, just the same as with your teachers, your speech pathologist is establishing a rapport with the students. So the interactions with the students are positive, respectful, cooperating during accepted tasks, coming to scheduled therapy sessions, completing different assignments and so forth that a therapist may, or programs that a therapist may have them do at home. And then making sure that they're able to really test the waters with that student, just like with anybody else. So is the student having a good day, a bad day, or I should say a difficult day or easy day, different verbiage there. But again, under those same directions, how is your therapist making sure that the environment is inclusive, least restrictive, and that the student is gaining the skills they need to gain. Organizing the time effectively, so meeting these deadlines, evaluating students, completing meetings, providing therapy, as well as utilizing time and duties needed to best fit the students in their schools. This could be paperwork, this could be arriving to sessions appropriately and so forth, but creating an environment not only that's friendly but efficient and something that you as a supervisor feel comfortable with. Like, I feel comfortable here. I don't feel stressed. There might be stressful things going on, but I don't feel like the speech pathologist is putting energy into that stress. Establishing standards for conduct and therapy sessions. So again, this is a little bit more difficult for speech pathologists because a lot of the kids that we have may have receptive language needs. So is your speech pathologist able to do so, establish those standards and establish those boundaries with a variety of students, with a variety of behaviors and communication needs? So conducting an established friendly environment, monitoring the students' behaviors, and also preventing certain things. So if a student is becoming overloaded and needs a break or needs to be redirected, is your speech pathologist able to do that? Organizing physical space and testing students for providing therapy. So again, educating that physical environment. I spent a little bit of time talking about some of the other components with the environment, but again, looking at that physical environment as well. Speech language pathologists having organized therapy spaces, no clutter. The setting is rearranged for a specific student to make sure that they're feeling comfortable, and making sure the materials and resources are either close by, right there, and accessible for that individual student's speech and language needs. I've always been told, especially with old supervisors and old coaches, engineer your environment. Take the time to do that, and learn what your student needs, as well as what you need as a speech pathologist. So engineering your environment to succeed and have your students and speech pathologists succeed as well. So, that's just a little bit about the educational environment domain. Our third domain would be delivery of services. So again, we're going to be looking at is the speech pathologist responding to referrals and evaluating students' needs. So again, is the speech pathologist establishing a protocol to when they get a referral or when they even have to start that process? Is there a screening process involved? Do they need support? Are the interventions and assessments evidence-based? Does the team know about the referral process? Does your building or do your teachers or fellow professionals know about the referral process? Are they developing and implementing goals and benchmarks to maximize a student's success? So is the speech pathologist following the department's format for goal writing, finding assessments, creative ways to incorporate speech and language goals and so forth? And are they individualized? Making sure that your speech pathologists are keeping it individualized. There may be some goals that sound similar, or some SDIs that sound similar, but making sure that those are varied a little bit. Communicating with families. I always say starting off strong with communication is very important. Making sure that they're being thoughtful of cultural, socioeconomic, and linguistic factors. So getting a cultural liaison and or an interpreter, making sure that depending on what their socioeconomic status is, or addressing students' communication needs, how are they affected in their home lives, or when they come to school and so forth. Again, making sure that communication is open even with the students and the families, which is very important. And if you do need more support with that, again, that's something that Patton can help you with. And to reiterate, all of these are open for support. Let me rephrase that. Patton is open to support any of these components, as well as just talking through things. But even if you do need support with, my speech therapist really needs help with making sure that we're writing the correct goals, making sure that there's a communication, or making sure that there is an eligibility criteria that I need a little bit of help with. We can't give you this is exactly what they need, but we can lead you in the right direction, and maybe give you some ideas. And even if it's student specific, like I don't know what I'm going to be doing with this particular student, that's very important too. Making sure that the administrative work is doable, that your speech pathologist is following department best practices, both federally, statewide, and through the LEA. Making sure that the information that they're collecting on is not just receptive and expressive languages, but also like phonology, fluency, voice, adjusting certain tests for needs and documenting that, and writing clear and comprehensive evaluation reports. So keeping an eye on that, demonstrating flexibility and responsiveness. So as a speech pathologist, able to amend an IEP with evidence that's need to change or make revisions, and do they know what the proper steps to do so? And do they know how to ask that question? I think that's huge with especially new speech pathologists, is being worried like, oh, I don't want to ask that question. And then later down the line, you're like, well, you should have been doing it this way. So that is something that, again, that open line of communication is really supporting, and flexibility and responsiveness to certain things. Okay, you're noticing that this student, everybody says, this is an example, everybody says that the student doesn't need speech anymore, and can go down, or the opposite thing, they need more services. All right, what are the right protocols for the speech pathologist to do to figure all this out? And administratively, are they doing everything correctly? And as a supervisor, being able to pinpoint those and offer that redirection if needed. But just some components to really think about that. It is, again, very, very important, especially for the school, but also for the speech pathologist to really get those delivery of services and their own accountability and ownership for creating appropriate goals and appropriate protocols for the school to make sure that all their students are thriving. And finally, professional development. So this domain being the fourth domain. The one thing, I don't want to self-brag here, but the one thing that I guess this isn't really a brag either. The one thing that was both a pro and a con with me with a lot of my supervisors was reflecting on my practice. So I would reflect on my practice, but then sometimes I would do a little bit too much reflection. And this was early on in my career where I would be like, did I do this right? Oh my goodness, what if I miss this? What if this happens? What if that happens? Blah, blah, blah. The typical new speech pathologist or teacher rhetoric that goes through your brain. But again, they'd also say this is also a skill set to make those specific changes, which also plays into the third domain. But the fourth domain, talking about reflection, is accurate. What are the specific examples of this reflection, and an extensive repertoire of suggested alternative strategies. So the one thing as supervisors that I also learned throughout my career is if there is a problem, what is the solution to that? And having a solution to that, not just saying, I can't fix this, but being able to say that I've been working with this is how I'm going to react to it. Taking one more thing off the supervisor, depending on what it is, but also providing support if needed. Collaborating with teachers and administrators. Again, communication is key, not just for our students, but also for our team members. So we want to make sure your speech pathologist is seeking out teachers and administrators, not working in a silo, not working by themselves, regardless of cases, providing information to parents, and be able to open up to their perspectives on individual students and making sure that they're consulting and collaborating with others. We really want that communication to be pretty high for our speech pathologists, especially for teachers, administrators, other professionals in the school. We're making sure that they maintain an effective data management system, so making sure that it's highly effective management and creatively monitoring how a student is doing in multiple environments and taking that data and being able to speak on that data, especially to the parents. How'd you come up with this? Why is it? What were you using to measure this? How many times were you measuring this? Where is this stated in the IEP? So making sure that they're doing that as well as speech pathologists. Participating in professional community. I want to take a little bit of time to talk about this because I don't think this particular component is talked about enough or is unable to be talked about enough. Professional communities and making a substantial contribution to your school district and being able to be a leader in your school is so important for speech pathologists. Whether it is attending conferences, trainings, seminars, and so forth. Being not only able to do that is such a gift and something that is marked in this particular domain, I think should really be focused on, because speech pathologists make a lot of great contributions, and being able to engage in professional community and professional development, which plays into the next component as well, is so important. And being able to turn that narrative of professional development to, I gotta do this again, I have so much stuff to do, this has been a wild week, I have this report and this blah 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 blah. Being able to establish to your speech pathologists and staff in general, I think is so important to say, thank you for joining me with this professional development and this learning, and giving yourself offering self-care to you, instead of just saying like, oh, this is just too much for me. This is, not really helping me, which again plays in to also not just collaborating with the professional community, but also collaborating with a department, district, or a profession that makes professional development, and going to workshops, being able to feel empowered by your education. So when looking at your speech pathologist and what you can offer them as a supervisor, if you're able to, please, 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 please take the professional development component very close to your heart, because I think that that is something that really helps a lot of speech pathologists become involved and stay motivated to learn. Professionalism, also this falls under it, very important too. Integrity, advocacy, and maintaining confidentiality. So, especially that last one, maintaining FERPA and HIPAA compliance, making sure that you're being professional with your, with your team, and with parents and with the students. That should already be pretty evident and obvious, but again, just that's something to measure as a supervisor too. And again, seeing if the speech pathologist can ensure that you're making evidence-based decisions based on a team approach. So really that's built into what an IEP is, and this this definitely ties into that involvement. So the last couple of slides, I just have some resources. This is the Pennsylvania Department of Ed resources regarding speech and language, staffing guidelines, SBAP, and also speech and language questions leading speech and language questions regarding their evaluation. So this is definitely helpful for administrators to use. Other resources, PISHA, or the Pennsylvania Speech and Hearing Association. So this is the body of speech language pathologists and professionals that help and support speech pathologists in Pennsylvania. A lot of fabulous resources as well, not just for administrators, but for your speech pathologists. You can always guide them to that. But as administrators, just keep that in mind, especially if you are new and you haven't worked with a speech pathologist before. PACE, Performance Assessment of Contributions Effectiveness of Speech Language Pathologists. This is a professional resource through ASHA. Again, something to review, and just some other links here as well. Well, I want to thank you today for letting me and giving me the opportunity to go over some administrative components through speech language pathology and what the history was, what you should be looking at as an administrator, and so forth. Like I said, my name is John Rose. I'm a educational consultant with Patton. I have added the Speech and Language Initiative Patton website. This has all of our contact information. My contact information, my phone number and email should be on there. But there are also multiple consultants with the Speech and Language Initiative throughout Pennsylvania, but also through Leadership, MTSS, English Language Learners, secondary transition. So please utilize that. I always say that we're very fortunate to have consultants that can kind of support us through that. If you have any other questions, like I said, please reach out. This has, again, been a fabulous part of the leadership series that's been created through Patton and the Speech and Language Initiative. I really appreciate your time. If there is something that a resource that you need us to review or talk through, like I said, feel free to email or give us a call. And thank you so much. Enjoy the rest of your day, and thank you for everything that you do. Goodbye.